The show is in progress.
So much stress that's going on in certain populations and certain individuals. I have a father who has who's being treated for cancer, and he's over 80, he's fighting cancer, and he's doing well with it, but the drug causes him to be a little immune deficient.
Right.
He has diabetes. He's had that since 1980s, and he does a great job of fighting it, but it makes him immune deficient. He's had some infections that he wouldn't normally get. And so he's at home, and he's sitting at home. He said, this is the man who at 80 is over 80 is driving every single day. Before this hit, he was going somewhere every day. He would not sit at home. He was involved with, as a past teacher, he got his PhD at the University of Alabama after doing 23 years in the military.
Come on now.
He would go and do tutoring for young kids in middle school and high school. He was involved with his fraternity. He was involved with programs to help individuals who needed home and support. He was involved with his church, and now he's at home every day.
And I have a mother-in-law who's, in her 80s, on the upper end of them. And she just said to us the other day, I'm going stir crazy.
Correct.
And I'm most concerned with this coronavirus in a lot of areas. The houses, people's homes and wellness is one thing, talking about the virus itself, but then the effects that don't necessarily show because of the virus, but right. It is. What happens when we get into, because we are moving towards lockdown. If you
Correct.
Can't see that.
We are very much so.
And this is a part of, if you're
absolutely.
Just tuning in, by the way, you are listening to the best version of Success in the Evening with Coach Ricky Terry we could give you. And in order to do this, we went and got one of the best doctors out of Atlanta, Georgia, who specializes in infectious diseases.
Yes.
And not only infectious disease. Tell me a little bit more about your background, because we've been talking for a while.
Mm-hmm.
And I think people ought to know who you are.
Right. Well, right now I am the medical director and operations director of Rise Multimedia LLC. And that is an education source, health, wellness, and recovery. So RISE stands for Resurrecting Inspirational and Spiritual Experiences for War, for Wellness, Awareness, and Recovery. So that's what we are. We're about education and wellness. And I got that from the fact that I was a physician treating patients for 31 years. And again, went through the HIV epidemic, went through the anthrax issues, went through Ebola, and, and dealing with infections that are associated, especially with the underserved community, with diabetes going rampant in that community, and dealing with the issues of fungal infections and pneumonias and those types of things. And so we worked very hard to not only provide information is what we thought was the most important, education and information. I have also been involved with a group which was involved with the research and clinical trials for some of the medicines that actually caused the turnaround in the HIV epidemic. So I've been involved with a lot of things and dealing with infections and the spread of infections, especially getting out information and support to the underserved community.
Well, you have been on the front lines for a while, my brother, and I thank you for your service. But you mentioned something, and it's being talked about at low levels. But who is this really impacting? We've heard, the elderly is really going to hit hard because, a weakened immune system. We've heard that kids may be carriers but not necessarily get sick from it.
Mm-hmm.
Has anyone started to do a breakdown, because we know it supposedly came, or factually came, whichever one you want to tell me is right, came from China, and there's already some xenophobia going on about that.
Absolutely.
How is it impacting the African American community, or how will it, or can we tell? Because I know it's blind, but sometimes some things stick with us more than others.
Okay. Entirely through my career, I have observed that when we get involved with illnesses and sicknesses, especially general broad illnesses, sicknesses that affect the community, the underserved and the minority community gets it worse. We get the most, I think we are most affected by diabetes. we're most affected by heart disease. We're most affected by HIV. You know, this is something that you just see over and over again. Prostate cancer, where we have higher numbers than other populations. And I think with the coronavirus, you're going to see the same. And I'm going to give you an example of something. I live in Atlanta. I live outside Atlanta. I live in an area which is considered a very high-income district of Atlanta. It's known all over the country, and some of the well-known politicians come from this area. I drove down about 20 miles to go to visit someone, and I left my area and went into the grocery store before I went down there. And I was, you know, I got toilet paper, bread, anything I wanted to go. When I got to that area, which is about 12 miles away, the cost for gas was about 12 cents more than where I was. And the grocery stores were practically empty. People were standing in lines. I had just got through talking with someone in my family about the fact that, oh, we don't have lines up here in Atlanta. And I had to call them back and say, whoops, my bad. I'm in the area that's mostly minority, and people are standing outside, and these shelves have nothing.
Nothing.
And so I'm going to be honest with you, and I'm not doing this as a person who's trying to instigate or anything else like that. I'm just going to tell you what I observed. And I have individuals who call me, and I tell them, get this particular product. And they say, this product's not here. And I say, well, wait a minute, I can get this product right around the corner really easily. I think this virus is going to hit the underserved, the poor, harder, and than the others. Because I think if you even look at some of the stuff that's going on, some of the changes that are being made to help those who have a little more privilege. One of the biggest concerns I have about the schools closing is I'm aware that a number of individuals who go to schools in unserved areas, they get the best 2 meals of the day. They're part of the breakfast program and the lunch program. With the schools closed, it is going to be very important for us to fight to make sure that they get what they need, because there's assumptions made. Oh, the schools are closed. Don't worry, the parents will make arrangements for the kids. Some of those individuals in those areas, they can't make those arrangements. Some of those individuals in those areas can't afford to lose hours of work. Okay? And so I think those are things we're going to have to pay attention to. So that's why I said to you, to me, the biggest effect of this disease is not going to be from the physical aspect, because not necessarily as many individuals, about 16%, close to 2 out of every 10 that get exposed to this virus show us symptoms severe enough to even present to a hospital. And it doesn't even mean they're going to be admitted. That doesn't even mean they're going to be, treated with anything significant. And probably right now, as we look at it, only about 1 in 10 is going to even require anything that would make us be concerned about death occurring, or maybe less than 1 in 10. But the fact is, how it affects us in the community is going to be 10 times worse, I believe. And so therefore, what I say to people when they say to me, what should we do? What should I do, Dr. Virgil? I say strategy, plan. I'm asking all of our individuals to plan. Start thinking about a change in life over the next 6 months. And what I say to them is, think about this. If somebody gets the infection in your family, who's going to be the person that takes care of that person? And where can you put them in your home where you can separate the 2 of you from the rest of them? One of the big issues with this virus is it's transmitted more easily than even the flu. And so whereas, we all have had this experience with a cold or flu where someone gets the infection in the family, that person's treated, a few days later, they're feeling better, and then someone else gets it. And then a few days later, maybe, but not everyone gets it. And we'll even say, well, I didn't get it, I wonder why. And some people say, I didn't get the flu vaccine, I never got the flu. But with this virus, it spreads more easily. And so if there's 5 people in the family, this 2 out of the 5 getting it, no. It's going to be 4 out of the 5, maybe 5 out of 5, but definitely 4 out of 5. And they're going to get it while someone else is sick. So you're going to have more than one person ill. So you need to plan and strategize. How do you plan on how your older family members are going to get food and support? with my father and my mother, we talked, and we know who's going to go out to the grocery store and pick up stuff. I went and dropped off things today so that they don't have to go up and be exposed.
Let's do this real quick. Because I know we had a hard stop too, and I do have behind you.
No problem.
Let's grab some things. One, you are, though we haven't said it clearly on this call, and I know we have some more questions, so we're gonna have to do those rapid. But washing hands, sanitizing, cleaning surfaces, those things have to happen, right?
Absolutely.
Even while you are self-quarantined with the family, those things still have to continue to happen?
Correct.
Okay. Darian, did you have a second question? You got to unmute. There you go.
Yeah, I'm unmuted. The second question was that, for somebody that works on cars, you often get oils and things on your hands. The different oils that you get on your hands, you have certain things that will break those oils down.
Mm-hmm.
I'm wondering, similarly, are there things that break viruses down that people look at to examine to go after this particular virus? And if that's the case, why would it take so long in order to find a cure? If you're working from a given point, sooner or later those established defenses, one of them should work. Why are they looking at, and I've heard so far as much time as a year before a particular vaccine may be developed for this? Why would it take so long at this point in time?
Okay, so very quickly, one, remember I told you that viruses get inside your cells.
Mm-hmm.
So whatever you use to kill the virus has to be able to get inside your cell and not kill your cell or kill you. So that makes it a little more difficult. We have many things that could probably kill that virus. But the question is, can we get a medication or something that we can get to enter inside you that will stop the virus but won't harm you? That's what takes a little more time. That's one. Two, as far as the vaccines are concerned, we have to find something on that virus that is abnormal that the body can recognize that will trigger your body to release immune cells or immune substances to fight that virus and protect you. So we can take the virus and we see the virus, but not everything on that virus actually gives enough strength of trigger. So we can actually find something, say, on the outside coat of that virus as the virus comes in that your body doesn't like, and then your body will attack it. But then not only must it attack it, but it also must send a signal to say to your immune system, make some cells or make some other things in my body that will stay in me forever, so that anytime this virus ever comes back to me, you will arrest it really quickly and kill it. So we can have things that actually, we've seen this before, we can actually make something and give it to an individual and they get immunity to that virus and it lasts a couple of months and then it's gone. So that's what takes us so long. We have to find the right component or part of that virus that not only triggers the body to attack the virus whenever it sees it, but then causes the body to leave some cells floating around or some other components floating around, so that if the virus ever shows back up again, they'll attack it right away and very quickly.
All right. Burl, did you have anything?
I want to say thank you. I really appreciate you dispelling that myth about the water. So that was really good to do. But my question is too, how do we get to a calm place? What do we need to tell our family, our friends, to get to a calm place? Because as you know, like around here, there's nothing on the shelves. There's no toilet paper, there's no water. They're even wiping out stuff that's the frozen section and everything like that. So what do we do? And what can we say to them to calm them down? I know they're our school system shut down for 2 weeks. I'm assuming it's going to be longer. Oh yeah, but let me back up a minute too. And I can understand and I can appreciate you saying that about the students not eating, but we put something in place for them to come and pick up their food. But how do we try to, in this chaotic time, calm people down about what is actually going on? What should we say to them?
Okay. All right. So just to let you know something too, Burl, my mother has asked me to get 5 things today for her at the store. I went to the store and got all 5 and just took them to her house. And so, that
is not the case.
Unfortunately, in some places, I just want to say that. So the calmness has to come from knowledge. This knowledge that you're sharing here, right here, letting people know, look, not everyone is going to die, but that you may get a flu-like symptoms, and then, you know, whatever, that you can handle it, you can get through that, and then you go about your business. And explaining to them how it's going to happen, what's going to happen, so they can expect certain things. It's when we don't understand something or don't know something that we have the most of fear. And so if I can say to you, hey, this is going to last about 14 days. On day 2, you might start seeing symptoms. The symptoms are going to get real bad up to day 5, and then they're going to kind of taper off. And also the symptoms are going to be fever, maybe a little headache, cough, and the cough gets worse and worse. You feel a little tightness in your chest. As long as it's just a little bit of a cough and as long as you're coughing and there's a little tightness in your chest and it doesn't progress, and you start seeing it tone down over a couple of days, you're going to be absolutely fine. If they can expect that, boom, they're going to be feeling better. The other thing too is this, testing. If you know who has it, if you can tell that you don't have it, you feel better. So testing has been a really important component of it. There are things that have happened that have actually made this outbreak a little worse than it has to be. And so that's another example of something like that. So information, education.
Oh, thank you.
You good, Burl?
Yes, I just want to say thank you again, because you know, I can tell my family now we can all chill. You know, hey, we can lose. We can lose a little weight this time. We don't have to eat.
Doctor, again, I want to thank you. And before I do though, Darian, because you have a father at home with you, is there a last question you have for the doctor?
The last question that I had, as far as that's concerned, is that, you know, as far as I work the 3rd shift at my other job.
Okay.
So pretty much my day is go to work, and I'm lucky enough that I work for a biomedical firm. So, you know, they're crushing us with information. So my day is pretty much go to work, come home, go to work, maybe stop, get gas, maybe stop, get food, come home. So I'm pretty much, you know, that pretty much is a linear kind of life that I'm living. What things do I need to do in terms of making sure that I'm not bringing something into the house, even though I don't have the kind of exposure that some people may have? I don't ride the train or the bus. I'm just in the car, and I'm going to a safe place, a quote unquote safe place, and coming home from a safe place. But what kind of things can people who are not in my type of environment or other type of environments, what do you do when you get back to the house and you've got somebody at home that's susceptible to these particular viruses?
Well, keep in mind this: hand washing, and use of and soap will do great with it, but you've got to wash for at least 20 seconds, and it's got to be aggressive so you can actually scrub the bacteria, the virus particles and that away with the skin and other stuff like that. And using, of course, the disinfectants that have 60% alcohol in them. The other thing some people are doing is they're washing their clothes when they get home. Washing machine kills the virus. So they're washing their clothes. So some individuals who are, say, in the medical field are coming home, changing clothes in an area, taking those clothes and washing them right away, and then putting on some new clothes from inside the house. So those are kind of things you can do. But washing does it. And when I mean hand washing, I'm talking about you get your food from someone, you drive at a drive-through, you handle your card, and they give you your food. Little hand washing. Drive on home, little hand washing. So the best thing I can suggest you is hand washing. It's really important because of the way that thing is spread through entrances in our face.
Right. Thank you so very much. I appreciate that information.
Dr. Virgil.
Yes.
I just wanted to ask, because everybody's asked something, but there's one question I have on my mind, and I think it relates to that calmness part. At what point do we hit the panic button? Should we be moving there now? You know, we're hearing more and more reports of a lot of fear coming out of certain people. There have been reports of, you know, people are now stockpiling or stocking up on ammunition, guns, and things like that. Should we be getting to a point where we are really becoming worried, you know, for our safety, not just from this virus, but from the people around us because of the beliefs and the thoughts going around about coronavirus?
Right. Well, you know, one of the things that we use to describe things like anxieties and stuff like that is an unreasonable fear. You cannot contain the fear of all people. There are individuals who are out there saying, this proves what I said about the fact that I need to have a bunker and food to live for 6 months because the society is coming to an end. And that's probably an irrational fear. We have the ability to deal with this. We have the ability to address this. So I would say to you, I will try to continue to give information to individuals related to this, but we may not be able to get everybody to calm down. And we have to deal with the consequences of that. But I believe, based on my previous experience, and we've had this experience before, that we will be able to overcome this. I'm looking for a 6-month period. I believe that, and I've been telling everybody, based on my experience, in the next 6 months, we'll be looking at this totally different.
We really want to thank you because, as you know, lack of information is what really causes people to lose it. Give them a sample of your background again so they can take this information and believe where it's coming from. Yes, sir.
Don't forget Miss Jones. Don't forget Miss Jones.
Miss Jones, a different call. Hold on
Okay.
1 second. But Miss Jones, just in case, did you have a question about coronavirus? You're up in Canada. How is Canada? Can you unmute yourself, Miss Jones? I got you. Okay, you're up in Canada. And before we let Doc go, do you have a question about this disease? Because how is Canada handling this?
Well, I mean, Canada is pretty much handling it in the same way. I think we have a little bit more faith in our leadership at this point.
No
and
comment.
Also our healthcare system is a little bit more accommodating to more people. But I mean, the fears are still the same. You're still seeing, the same sort of panic in the grocery stores, not to the level that I've seen on the news, but of course you're seeing the worst case scenario on the news. So I mean, at this point,
Sure.
at the end of the day, it's really, like you said, and the advice that I've been hearing has been consistent. It's really about washing your hands, and that's the only safeguard, as well as social distancing and all that kind of stuff. But I mean, the minute you go outside, is whether you're going to an airport or not, like you're still susceptible. So you just have to do your part to limit that and to wash your hands. That's all I know. So I don't really have any questions. It's just watching things unfold in awe of seeing this. I mean, I've been around for SARS. I've been around for H1N1. Like this is still unprecedented times.
Yeah, this is taking the cake.
Yeah, Rick, I will say this. People have to understand that these steps of social distancing, these steps of washing their hands, these actually do contribute to us dealing with this problem. In other words, this problem would be so much worse if we didn't do those things. And it will resolve sooner if we do them. So you might not understand why you washing your hands before you get a basket in the grocery store and then washing your hands after you leave out the grocery store, what that has effect on. But it truly does have an effect. It reduces. And when we in the medical profession, when we're dealing with this, we're talking about exponential cases. So we're talking about millions of individuals being infected with this virus and millions dying. And so just as the virus rises exponentially, hand washing and blocking it causes the outbreak to drop exponentially. So it is important to do those things. You are doing something to help when you do those things.
Well, I won't tell everyone, don't freak out. My wife, go on YouTube, learn how to make you some hand soap, hand sanitizer. My wife made some last night. I mean, she really did.
Aloe vera and rubbing alcohol.
Come on now, she made some last night because, it was all off the shelves. But washing your hands, washing your clothes is going to be big. I think the whole idea of getting to know each other again and getting to a point where we respect each other is going to be big. But Doc, I was trying to say before we got you off the air, now that all the questions, just in case somebody tuned in late and we are doing this differently than before, give them your background so they know we didn't go get Joe Blow from down the street. One more time.
Okay, my name is Dr. Luther Virgil. I'm an internal medicine physician and I have a subspecialty in infectious disease. I was trained thoroughly at Howard University in Washington, D.C. I have actually been involved in dealing with patients in the HIV epidemic, in the anthrax SARS, Ebola, all of those things, and helping to put together policies and procedures and making sure we deal with those. And also in the treatment of patients, primarily specifically in the HIV arena. I have worked with the CDC, worked with NIH. I am currently one of the co-chairs on the Georgia Department of Health, Georgia Prevention and Care Council. I've done a few things in my life. I'm a little older than I look.
And you're pretty. We're gonna leave it there. I know this. You've helped a lot of people, and you are still helping people. And I want to thank you and all the frontline people who are giving countless hours to study and service, so that when crises like these do come, this land is prepared for it with our medical people. And so thank you for giving us your time today. It means a lot to us. And Godspeed. And if there's anything you want to put out or think that we need to know, you're always welcome back here. You come highly recommended.
I appreciate it.
All right.
Really
Thank you, sir.
Thank you all. Have a great day.
Thanks,
Thank
guys.
you. You
Appreciate it.
too.
Thank you.